Hey, this is Dr. Garrett Harper. We are going to talk about tummy tucks. Now, there's so much that we could talk about, but I just want to give you a little bit of a semantics lesson so that when you come in, we're talking about the right thing. What I want you to get out of this is understanding the different surgeries that can be done and the different aspects to the surgeries that we combine in order to address your issues and get you the final result that you've wished for. A full tummy tuck is when we address things from your sternum to your pubic bone. That means the dissection is going to lift up your skin and subcutaneous fat off of your underlying muscles. And those are your core muscles, your six-pack muscles, your obliques, everything that allows us to turn and crunch and move. Those are the muscles in the front of your abdomen. Now, after pregnancy, a lot of times a woman's abdomen is not going to go back to where it was. You may be one of those women who realizes that you don't have the same flatness to your stomach. Trust me, your muscles are fine. Your muscles have their origin up here at your rib cage. They have their insertion down on your pubic bone. Everything's fine. They're just not being held together in the middle like they used to, because when you had a growing uterus, that's what had to separate and stretch out to accommodate the baby growing inside of you. You have the baby, the muscles are great, but that tissue that's been stretched out sometimes has been stretched out too much, and it doesn't rebound back to where your muscles are now touching in the middle again. If we need to bring your muscles together because you have what's called diastasis, then we do that with a corset stitch. And this is where we actually suture your muscle edge to your muscle edge. We don't cut muscle, we don't ruin muscle, we don't damage muscle. We're literally just bringing the edge back to the edge of the corresponding other muscle so that things are lined up in the middle like they were prior to your pregnancy. So if you hear things like muscle plication or corset stitching or tummy tucks, that's when we're not only addressing your skin and subcutaneous fat, but we have to address your muscles as well. Mini tummy tucks or mini abdominoplasties or mini dermalipectomies are when from your sternum to your belly button looks pretty great. That's not where the problem is. The problem is from your belly button to your pubic bone. That can be any number of things. Some women have this kind of pooch that sits over a C-section scar, or that tissue got stretched out preferentially and more because that's where your uterus is growing during a pregnancy. So for those women, we're really only dissecting up to the level of the belly button. We're not coming all the way up to the sternum. And then we're addressing either the muscle separation in that area, or we're just addressing excess skin and soft tissue, fat, those types of different components. So morning of your surgery, we want to make sure that we place the incision exactly where it needs to be for after your surgery. There's an important kind of concept there that we want to make sure that your incision is hidden within your bikini line or your underwear line. So I'm actually going to have you wear whatever's the most revealing underwear or bikini, because that's your goal. I want you to feel confident in that after surgery, and you'll bring that in the morning of surgery. You'll be wearing those, and as you raise up on your skin, we will draw that out and make sure that your incision stays there. Now, we don't want to get the incision too low. We can't get it too close to the vagina, or it will pull up on that area and your vagina will have a windblown look, which is never a positive thing. So we've got to stay a certain distance from it to leave it alone, but still rejuvenate that area. Now, the incision is as long as it needs to be. I typically tell patients, if you have some overhang in your skin, stand in front of the mirror. Don't let anybody be around you so that you can really relax. Take a big deep breath in, let it all out. Don't engage your core. Don't try to flex your muscles or suck in or anything like that. And wherever you start to see some overlap in your skin, that's how long the incision needs to be. What we don't want to do is we don't want to have an incision that we keep extra short and then tuck a bunch of skin in and bunch it up right down there at the bottom. What we want to make sure is that the incision lays flat, that it doesn't look artificial. I want you to look like you've got a natural abdomen that nobody's ever touched. And that's basically how we figure out where your incision goes. Where the extent of the dissection goes depends on where your problems are. If we have to go all the way up to the sternum because you've got muscle separation the whole way, we will. If your muscles are great and you only need your skin addressed, that's all we'll take out. So you'll have 2 drains afterwards, you'll have tape over your incision. It's imperative after your surgery that you wear your abdominal binder for support, as well as staying flexed at the waist. And I mean, I want you 90 degrees. So if you're in a recliner, I want pillows underneath your knees. I want to make sure that you're bent over. We'll send you home with a walker to ensure and to remind you that you need to stay bent over in order to increase blood flow. We need as good a blood flow as possible for everything to heal. If you stand straight up and you put your blood vessels on tension, they are going to get smaller and smaller, and you're not going to be able to deliver oxygen down to the tissues you need to heal. We send you home with a walker for the first week. You've got 2 drains for the first week if you're doing a full tummy tuck. If you're doing the mini tummy tuck, it's only 1 drain. The first drain comes out at 1 week, the second comes out at 2. At that point, you're drainless. You're standing upright, you're putting your running shoes on, you're starting some light cardio, and you are seeing the light at the end of the tunnel. Now, for post-operative care, you may require either pain pills or muscle relaxants or a combination of both of those. Now, we use a 72-hour long-lasting local anesthetic called Exparel that we will inject into your muscles as well as into your incision. That's going to bring you a lot of relief. We worry sometimes that it brings so much relief that you're going to do things that you shouldn't. So that's why it's really important. Go home with a walker as a constant reminder, hey, I'm not supposed to be like skipping rope or doing too much right now. I need to stay bent over even when I'm sleeping and reclined. It's okay to recline, but bring these knees up, put some pillows underneath your knees to maintain this kind of 90 degrees good posture. When we've elevated your flap, I want you to have a flat back. The front of your abdomen and the skin is going to seal down according to your posture. So I say pretend like you just ironed your blouse and you have to get to church without it getting wrinkled. So I want good posture, flat back so that all this stays flat instead of bunching up centrally. I want good posture, flat back, bent at the waist. You're going to have a beautiful result. That's the nook and crannies of an abdominoplasty or a mini abdominoplasty or a tummy tuck or a dermal lipectomy done here. Thanks.